Can you remember the last time you felt incredibly unwell and wanted to book in to see a doctor? Well, you'll also probably recall how frustrating it can be to book an appointment. If you're looking to see a GP, you could be waiting up to 3 weeks. If you're looking to see a specialist, this can be 3 months to a year. Look at Jimmy at the end of the conveyor belt. We've all been or know someone who's felt like Jimmy at some point in time. Now think, you're over there patiently waiting for your appointment, but a person in front doesn't show up for theirs and doesn't cancel in advance. This is a no-show, otherwise known as a missed appointment or non-attendance. This event not only affects other people in the queue, including yourself, who could have been treated instead, it has an array of other implications. For one, it wastes healthcare resources. In the United States, it's estimated that no-shows cost $150 billion per year. That is equivalent to more than enough coffee to keep me caffeinated for the rest of my PhD journey, if not for the rest of my life. But on a serious note, those wasted resources could have been allocated to the provision of other healthcare services. Aside from monetary costs, non-attendance also contributes to other things. It can increase the length of waiting lists, it wastes staff time, and it may be detrimental to a patient's health through patients failing to be able to receive timely healthcare. All in all, non-attendance is a money problem, it's a staff and resourcing problem, and it's a patient experience problem. Confronting non-attendance and finding ways to reduce it is complex and challenging, but it is attainable. Would you like to know how? Through the increasing digitization of healthcare information systems, which are affording us with new opportunities. Imagine if you could use an online platform that would allow you to schedule appointments at times convenient to you, would remind you when your appointment is fast approaching, and could even provide you with the option to choose a telehealth appointment instead of one in person. Exploring these digital opportunities is incredibly exciting and brings me to my research and how it will help chip away at the no-show problem. To start, we know that there's a lack of evidence that provides us answers to the following questions. The first, remember that $150 billion no-show cost in the US? Well, we don't actually know the extent of the problem and how much it's costing us in Australia, including here in Queensland. And the second, there are several digital solutions that exist and are emerging, but we need to map out what works and what doesn't. Answering these questions will provide insight into how intelligent digital solutions can help us make better use of our scarce healthcare resources, and it can help us in understanding how we can improve efficiency across that conveyor belt. In doing so, my research will improve the experience of doctors and the experience of patients, like yourself or anyone else who feels like Jimmy. After all, a missed appointment does not need to be a missed opportunity.